Advocacy in a time of unknowing, speaking up for patients, personnel, policy, our profession, and our person. On January the 10th of 1991, my wife and I became advocates when our youngest child, a daughter named Brooke, was born with Down syndrome. I had been a nurse for many years, but certainly my experiences around advocacy had been limited prior to that point. Today, we're going to share some things related to what we might be doing and the experience of COVID-19 to better advocate for patients, for our profession, for ourselves, for our colleagues, and for health policy. At the American Academy of Nursing in Washington, D.C., the gathering in 2018, Alicia Georges, who was then the president of AARP, said that being at the table is not enough. As nurses, we need to speak up. And then she added a line, and it's long past time for us to start talking back. When it comes to advocacy, there are a lot of issues going on right now with COVID-19 that bring us to moral outrage. But if we stay there in moral outrage, the only thing that people hear is the anger. So when it comes to advocacy, we need to be finding ways to be systematic and intentional in the way that we approach the things that we're speaking of for patients and for our colleagues, our profession, and ourselves. Jeff Bauer is a PhD in health futurist, and he said, which of all the clinical professions excels at patient advocacy? He thinks that it's very clear that we as nurses excel at patient advocacy. And lastly, Sandy McClowney indicates that we as nurses are trilingual, that we speak to other professionals, to our patients, and to those in power, and that nurses can advocate to build bridges we need to help those in poverty. Certainly, the social determinants of health are getting a great deal more attention post-COVID-19. In this time of unknowing, nursing has an opportunity at this threshold event that's resulted as COVID-19. In the words of Dr. Anthony Fauci, the COVID-19 experience is shining a very bright light. In our profession, it's shining a bright light on our competencies, on our preparedness as a profession, shining a light on social determinants of health and leadership and patient advocacy. This pandemic is a threshold experience and offers us a potential catalyst when it comes to the stories around compassion, morals, ethics, resilience, and the better angels that come from us as we relate to our families, communities, professions, our health systems, governments, and the global society. COVID-19 can also provide the fuel that we need to motivate us to drive transformation. But as indicated a little earlier, anger alone is not advocacy, nor is our rage over injustice, inequity, immorality. We have to find a successful means to bring about change. So when it comes to advocating for nursing, those who are involved in public policy follow a number of different steps depending on which resources you look to. The ones that I'm familiar with indicates that the first thing is the knowledge of the process, whether it's legislation, regulation, some funding that you need to get, perhaps from another source. The knowledge of that process is vital. There are aspects of how a bill becomes law. We've seen that, and it's used in lots of courses these days. We know that when it comes to regulation, we need to have connections there and need to know the processes when it comes to regulation. And certainly for those that are involved in funding, we've got to make sure that we have a clear picture on that as well. A second part of advocacy when it comes to health policy is lobbying. Knowing the people that are involved in the process are very important. Relationships and rapport need to be built in advance of one trying to drive a bill forward. There are some situations where it's successful when there's an issue that's come up and you might be connecting with that elected official or that regulator for the first time. But building a long-term relationship is generally the most effective way to go about doing that. So engaging the elected and appointed officials well in advance is important. And no matter how good you are at doing that as a nursing professional, as perhaps a policy person, the reality is that you can't know everybody. So as a result, we hire lobbyists. We hire firms that are able to establish those relationships over many, many years. And when it comes time for us to need to engage, then the lobbyists can help us to connect. Grassroots are important. One of the things that Sigma Theta Tau does often is to reach out to us as the membership. They find out from us what the issues are. They engage us in dialogue related to what we might do to advance some of the things that we need to address in the nursing profession. But getting the grassroots support is important. It is you and me as individuals who are the constituents of elected officials from around the country. So when it comes to state officials, when it comes to congressional people, those who are involved in regulation, when we are the people who are their constituents and we're the ones that are voting, we carry a great deal of clout. Our friends in the health policy arena help us to better articulate the conversation, and the lobbyists help us engage in the relationship and know the steps that we need to be going through and who we need to connect with. Grass tops is a term that's not often used, but grass tops refers to those local elected officials. So in the event that I'm going to try to engage the governor here in my state of Louisiana, I might have more success going to someone who I know who is a state elected official, either representative or senator, maybe one of our mayors, maybe someone who's well engaged and involved in some of the county or in my case, parish government. The people who are involved in elected office generally have relationships, so sometimes getting their support can help us to get to the governor. That same thing is true when it comes to people at the congressional level in Washington, D.C. So knowing that term, grass tops, can be very helpful to you. And one of the areas that most people feel less than comfortable with, but is part of the process, and that's political action committees. If you see the acronym PAC, Political Action Committee, they're referred to as PACs. Those PACs give you an opportunity to engage in campaign contributions. It gives you the opportunity to advance certain aspects of the potential elected officials' agenda. So getting involved personally, trying to help with election can certainly be a difference, and that happens through political action committees. So getting involved in your particular party, getting involved with a particular elected official certainly makes a difference, and those political action committees often make the entry and access to that elected official much smoother. Other aspects of our getting a message across when it comes to advocating is, and in the health policy courses I teach, I remind students that the papers that they write and the processes that they follow should certainly include three very important aspects of perspective. The first is the heart-focused perspective. In my own family, my dad dealt with dementia for 7 years. Mom and Dad had 10 of us. I happen to be the oldest. And the good news is that all 10 of us lived within 20 minutes of Mom and Dad as he was dealing with dementia. In South Louisiana, people don't wander too far from home. So it was not only the 10 of us, but also 10 spouses, and at that time, around 30 grandchildren. Dad's last year, he was bed and chair bound. We were able to engage in the care that Mom primarily provided. And when Dad began wandering at night, many of us took turns spending the night. Other family members took on other roles. We were all 10 of us at Dad's bedside in the last couple of hours before he died at home. And one part of our story is that because there were 10 of us plus 10 spouses and around 30 grandkids, Dad did not spend one night in an institutional setting over his challenging time with dementia over 7 years. Our story is important to us. Because we're family caregivers, the data piece is a second part. The story connects with the heart, the data connects with the head. There are 54 million family caregivers across the United States. This is from a recent report in the spring from AARP. 9 million more than in 2015. So 54 million family caregivers. 1 in 5 people across the United States is a family caregiver. The economic aspect of the conversation is also important. So you've got the story that is heart-focused, the data is head-focused. The economic impact of it is financially focused. About 90% of all care for seniors and the disabled across the United States is provided by family caregivers at home with no reimbursement. So the family caregiver is providing 90% of all long-term care across the United States. The Rand Corporation studied this a number of years back, and in 2014 reported that the economic impact was $522 billion a year. At that time, Medicare's total expenditures for the Medicare program in a year was about 100 million less than that. So again, talking to the heart, the head, and to the financial impact or to the wallet. Many of you have heard this, that the most important test in healthcare is the wallet biopsy. So another aspect of this, besides advocating for the patients, is advocating for the profession. COVID-19 has made it very clear to us that we've got some pretty significant challenges in healthcare. From a nursing perspective, nurses need more emergency preparedness education, both pre-licensure and after once we get into the practice setting. We saw how extraordinary it was and how painful to see that healthcare professionals had insufficient personal protective equipment. We need to have personnel safe in healthcare settings. And in this case, we're also talking about the safety of our families. Advocating for staffing is important. Many of you have read stories about some of the nurses caring for COVID patients and not having much of a break, working very long shifts and consecutive days. Staffing was an issue prior to COVID-19. So certainly another area in which we need to be advocating for our profession. Mental health support, again, has always been an issue for those of us who are nurses and our colleagues who are other healthcare professionals. That's become more obvious in the midst of COVID-19 because of the issues around moral trauma and moral resilience that we'll be dealing with. So our emotional hygiene and our mental well-being are vital. There's so many issues around diversity in nursing, and COVID-19 certainly has given us the opportunity to see the impact that has been visited upon people of color across the United States. I think that as we see things continue around the world and we see people in third world countries, we'll see some significant issues related to aspects of diversity and problems that we have. Certainly we need to be looking more at our own profession being more diverse and seeing what we can do to advance that. Educating the public related to our profession is very important. While we're the most trusted profession for 20 years running, the reality is that the public really does not know our level of education. They don't know that there are so many competencies that we have that we're not practicing. Issues around messaging and visibility are things that we can be doing to better advocate for ourselves. We hear often about the shortage of nursing. It'll be interesting to see how this conversation advances in the midst of our pandemic situation. And lastly, we need to find ways to close the education, research, and practice gaps when it comes to nursing and healthcare. So let's talk about our own self-advocacy. What are we doing to better care for ourselves? The research indicates that physical well-being, psychological well-being, our social functioning, not only within society, but within our work settings and between one another as professionals. Issues related to pain, not only physical pain, it's well documented for a lot of nurses, but aspects of psychosocial pain, difficulties, again, that we're dealing with around moral resilience, moral trauma, and moral residue. Our cognitive functioning, certainly advancing our education, advancing our understanding of the particular practice settings that we're in, are all very important. Vitality, our ability to bring our best selves to the role as nurses, and our overall well-being. All of these are vital if we're going to be doing a better job of advocating for ourselves and self-care. So I think it's important for each of us to take a look at ourselves, to see who we are advocating for, who are the primary folks in our lives that are calling us to be better advocates as nursing professionals. In this particular case, the picture down to the left is our youngest daughter. Brooke is number 5. I mentioned her at the front end of the story. Brooke has Down syndrome, and I have been, along with my wife, we've been advocates for Brooke from the day that she was born. We're fortunate that she's healthy, other than having a physique like her dad. She's high functioning. She brings us great joy and teaches us something new just about every day. Her older 4 siblings are all extraordinary, very successful professionals, and it is in large part due to the lessons that their younger sister imparted for them. The picture down to the right is part of our nursing family. We have 24 registered nurses in our immediate family: aunts, uncles, nieces, nephews, and cousins. So when we advocate for the profession, we're advocating for those people that are near and dear to us. And I'll add that also today, I'm advocating for a brother of mine. On the day we're recording this, a brother of mine was admitted to the hospital with double pneumonia as a result of COVID-19. So our role as advocates becomes vitally more important in the midst of this significant threshold event. But advocacy as nurses has always been important, always been vital. I'd encourage you to reach out to Sigma Theta Tau. There are excellent expertise there related to aspects of health policy and advocacy. Sigma Theta Tau also has relationships across the nursing profession. So I encourage you to reach out to those in the event that you need some engagement around an issue that you have. And I'm also happy to receive calls or email from you related to your own conversations around advocacy for the nursing profession, for patients, for health policy, and for ourselves. Thank you very much.